Dear brothers and sisters, my name is Dr. Dennis Nturibi, Managing Director at AskADoc. I thought it would be wise to put together this message, especially for our clients, but also for our country at large. It is my intention to put the current COVID-19 situation into context from a medical perspective, to help our people understand why we need to be proactive in our actions. So that I can keep this statement as short as possible, and to point I'll be referencing my write-up. We are in full support of the government initiatives put in place yesterday evening, and are actually grateful for this decisive decision. First, it is important to understand who is currently at risk of catching this infection, so that we reduce the amount of panic happening at the moment. According to the case definition as given by our Ministry of Health, a suspected individual who is having one of the three following symptoms, either a fever or a cough or difficulty in breathing, but on top of that, they must have one of the following four criteria. Either they traveled to a country that is known to have widespread coronavirus cases, or they have come into close contact with a confirmed or probable case of coronavirus infection, and all this is within the last 14 days, including travel, or has come into close contact with someone who has symptoms and is known to have traveled in the prior 30 days, or has visited or worked in a healthcare facility where it is known that coronavirus patients are being taken care of. Given this definition, therefore, it is clear that if, for example, your friend or colleague has a cough at the moment, but does not meet any of those additional four criteria, it is unlikely that they have coronavirus. In doing rigorous contact tracing, public health officials are aiming to ensure that there is no spread of COVID-19 within the community among people who have not traveled. This is called community spread, and at the moment this remains our most concerning issue as a country. So let me define community spread. This is when people are infected by the virus in an area, and some of them have no idea how they picked the virus. At the moment in our country, we do not have community spread. All the cases currently are traceable to the index patient as identified by the Ministry of Health. The risk of community spread is highest when we have large gatherings. For example, political rally, professional conferences, sporting events, religious gatherings, among others. It is also important to realize that schools, and in some cases other situations like barracks, where people or children are living together in large groups, form a significant potential focus for infection. And then of course we know, in addition, that asking children to maintain ideal personal hygiene practices when they are together and being children is not very realistic. In such a space, an infected person who most likely will not even know they're infected or are in the early stages and are not manifesting any symptoms, then spreads the infections to others. When this is repeated a few times, then communities run the risk of widespread of the virus within the community without the possibility of contact tracing. And this is what has actually been seen in other countries like Italy and Korea. Many of us have also misunderstood the concept of social distancing, self-isolation, or contact tracing. Now, social distancing is one of the best examples of social distancing is stopping the gathering of large groups. That forces us to keep a certain social distance. Self-isolation or self-quarantine is when maybe someone suspects they've been exposed to an infected person, and they make the decision, personal and conscious decision, not to go out into the community. So they stay at home within their own environment. They can also, in fact, decide to also not engage with their family members, to isolate themselves from their family members. And this is being recommended to be done for 14 days, because if one has been in isolation for 14 days and they are not sick, then it is unlikely they will become sick. It is not realistic to expect the government agencies to catch everyone who has traveled into this country, or even more difficult is everyone who has come into contact with a potential coronavirus patient. It is therefore the reason we personally have to understand the implications and the risks and concerns and take measures at a personal level to protect our community. Okay, not so much to protect ourselves, but to protect our communities. Even though we may not be severely sick, widespreading of this infection will have many other consequences on us, both directly and indirectly. It is not ideal to be terrified of this virus from a personal health perspective. While this is a concern that cannot be invalidated, in my professional opinion, the larger concern is what would happen if we have widespread of the infection within our community. The stress this situation would put on our current health infrastructure would be a major challenge. We also run the risk of diverting already stretched resources away from our more common and widespread medical conditions like malaria, diarrhea, HIV, and trauma cases. When a country gets to a point where other countries like Italy have arrived at, the economy also suffers considerably. For a country like Kenya, where a majority of our people have to work on a daily basis to be able to eat for that day, we should want to take all measures to avoid getting to that point. When our brothers and sisters who have to work to earn a daily wage cannot work, then we quickly find ourselves at a dangerous tipping point. Therefore, in summary, let us please stop sensationalizing this infection and instead focus on keeping the cases within our borders as low as possible. Fewer cases mean that the healthcare establishment can manage those ones confidently. It also means that over 90% of the workforce can continue working without the need for extended large-scale community quarantine measures. Based on past experience with pandemics across the world and the journey already taken by other countries with this pandemic, we expect that this infection will remain a global health issue for quite a while. Instead of downplaying this infection as has been done by some countries, it is in our best interest to remain calm, focused, and strategic in dealing with this over the time frame that we expect to be dealing with it. I urge anyone who can accurately translate this message into Kiswahili or our mother tongue languages to please do so that all can benefit and we can all pull together in one direction in managing this crisis. Be blessed. Thank you.